This is a review of the arterial puncture skill competency for Lakeland Community College. Before students attempt the skill competency at the clinical site, there should be a signature under the lab evaluation signature from either Kathy Kenny or myself, David Goswick, with a date associated with that. Plus there should be a check mark next to all the lab boxes going down for each of the 25 steps. There should be an appropriate student name and the year started. To start out, the student should be able to either check for the doctor's order or verify the indications per protocol at that particular hospital. If there's a protocol for drawing blood gases, gathers the equipment, so the appropriate equipment has been gathered by the student prior to entering the room, which can include blood gas kits, maybe a washcloth or clean washcloth or clean towel in order to properly position the hand. They'll wash their hands appropriately and put on gloves. If there's any contact precautions, they will be aware of that in gown up, etc. They'll identify themselves, who they are to the patient, and identify the patient. They'll explain what they're going to do, why they're going to do it, and what it's going to show. They're going to assess the different sites. First, students are told to check for radial first, then brachial, and then usually femorals, obviously for during code type situations. It's not the first spot that we would go. So observe if there's any type of fistulas or purpuras or any infection in the area. If there are, they're going to obviously go to another site. If they do choose one of the radials, whether it be the right or the left, they're going to confirm collateral circulation with the Allen's test. So the Allen's test is when the ulnar and the radial are both closed off. The patient tightens up their fist, and then the patient opens their hand. The student releases the ulnar artery and checks for perfusion back into the hand within 5 to 10 seconds. So that confirms collateral circulation to the hand. If something were to happen to the radial artery, it can still be perfused. Patients are properly positioned for the procedure according to the site. Prepares the site of the puncture, so if it's iodine that's used at the clinical site, students will confirm to make sure that they are not allergic to iodine. Otherwise, they're taught to use alcohol, starting at the center and working their way out, not contaminating the site. Puts on appropriate eyewear if necessary. And if there's any type of local anesthetic that's used, such as lidocaine, that's used at this time. If it's a radial stick, students are taught to insert the needle at a 45-degree angle. Reposition the needle if necessary and appropriately. So if they go in at a particular angle, they pull out at that same angle until the bevel is shown, and they are taught to reposition the needle up to 3 times per needle stick. Students should have obtained the appropriate amount of blood, so before they even stuck, they should have preset that sampler, the syringe, in order to get that. Withdraws the needle, secures the syringe per the policy of the hospital, and then immediately grabs the gauze and holds pressure on the site until the bleeding stops. When they're done holding the pressure on the site, they will assess the site. They'll check to see if there's a pulse distal to where they're stuck. They're going to find out if there's any tingling in the fingers of the patient. and they'll prepare the sample for transport. So obviously removing the needle, mixing the sample with the heparin, and then noting whatever the oxygen device is, whether it be nasal cannula or whether they're on the ventilator or CPAP, etc. They want to find, if they're not on a ventilator, they're going to get their respiratory rate, or even the respiratory rate when they are on the ventilator. So you have the oxygen, the FiO2, and then the CO2, whether it be ventilation through the ventilator or just respiratory rate without the ventilator. And then delivery device. They'll dispose of equipment per policy of the hospital, restore the setting, maintain asepsis throughout the procedure. They'll document the procedure however the hospital requires that. Assures timely transport to the lab. So the maximum amount of time is 30 minutes. Communicates finding with personnel, so that would be communicating the results with either another therapist or to the nurse or to the doctor. Again, the 3 signatures on the bottom. Peer evaluation is where students will work with each other in the lab and they sign off before the laboratory evaluation. Sometimes students don't always have that, and that's okay. But what we really require them to have is that laboratory evaluation signature prior to them doing it at the clinical site. That way we know that we've gone over it with them and they've passed the skill check at the clinical site. So that really needs to be done before they do it at the clinical site. If they don't have that signature, then you really should not sign them off or even allow them to attempt it. They have to have that laboratory evaluation signature before they even do one at the clinical site.